Alright, welcome to block 2. We're going to be doing trach care suctioning today. Remember that you must have 4.5 hours logged into Trach prior to this checkoff. Otherwise, you will be turned away. Alright, so first thing we'd like to do is standard protocol.
Hi, I'm Clint. I'm going to be your student nurse today, and we're going to be clearing out your secretions through the trach there. Just band and verify your name, date, birth.
My name is John Smith, 85XX.
Okay, great. I'm going to perform some hand hygiene and provide some privacy.
Alright, perform a thorough respiratory assessment.
Okay, so we're going to start by listening to your lungs. I'm going to listen to all 6 fields on the anterior, posterior, and lateral. So after I've listened to all of the fields, I'm just going to ask you how you're feeling, and are you breathing okay today?
Oh, I still feel like a little bit congested.
Okay, so I'm also going to check your pulse and your pulse ox, and then you can go ahead and read the next step there.
Alright, so assist patient in attempting to mobilize secretions.
Okay, so I'm going to have you cough and try to get out as much as you can before we do the suction.
It's just not coming out.
Okay, well, we'll get the rest out with the suction.
Okay, hyperoxygenate patient.
Okay, so I'm going to turn your oxygen up a bit so that way you can really breathe deep before we have to take your oxygen mask off.
Turn on suction to continuous suction.
Okay, so I'm going to turn the suction on to continuous.
Open suctioning kit and tracheostomy care kit, and the saline in the basin is optional if desired, using sterile technique. If you break sterile technique during the procedure, it is considered an auto fail and you will need to remediate. Pour saline into trach care kit. Apply sterile gloves, or you can apply a clean glove to the non-dominant hand and a sterile glove to the dominant hand. The gloves that come in the kit are one size fits some. Attach sterile catheter to non-sterile suction tubing with non-dominant hand, keeping the catheter sterile and the dominant hand sterile.
Okay, so let's see my sterile hand. Go ahead and grab that. This is non-sterile now. Okay.
Test suction in sterile saline.
Alright, suction works.
Remove oxygen source with non-dominant hand.
Alright, so I'm just going to take your oxygen off. We'll be as quick as we can.
Insert catheter 6 to 8 inches into trachea during inspiration without applying suction.
Okay, so I'm going to go ahead and put this in. Just take a breath for me. Okay, we're about 6 inches in.
Apply suction intermittently while withdrawing and rotating the catheter. Apply suction for only 10 to 15 seconds.
Okay, so I'm going to apply some suction as I withdraw this, and you're going to feel that in your lungs.
Monitor for signs and symptoms of hypoxemia. Use non-dominant hand to reapply oxygen while holding the catheter coiled in the non-dominant hand. Keeping catheter sterile in dominant hand, assess patient's breath sounds and pulse, allowing patient to rest with oxygen in place for several minutes.
Okay, so now that we've done some suctioning, I'm going to go ahead and reassess your lungs and see if we got some of those secretions out. Okay, so your lungs sound a little bit clearer. Do you feel better?
I sure do.
Alright, great.
Rinse catheter in saline solution and repeat suction if necessary.
Go ahead and rinse that out. We're all done with this.
Turn off oxygen or turn off suction source and dispose of equipment. Leave oxygen on.
And suction is off, oxygen is still on.
Wash hands and don clean gloves.
Perform hand hygiene.
Remove inner cannula by touching the outer aspect of the inner cannula. Unlock and remove.
Okay, I'm going to go ahead and take the cannula out so that way we can clean it.
Do not touch the part that is in the patient's inner trach. Place the inner cannula in the cleaning solution. Apply sterile gloves, clean and rinse, and replace the inner cannula. So if that were to happen during your checkoff, you would state, I would get a new inner cannula.
Okay, so new inner cannula.
If you catch yourself, that's fine. If I catch you, we have a problem. At this point, you need to replace the inner cannula.
Okay, so I'm going to go ahead and put the inner cannula back in for you.
You are no longer sterile. Clean and dry the stoma and the outer cannula.
Okay, so I'm going to go ahead and remove this old dressing. And we're just going to clean around the stoma. And while I'm doing that, I'm assessing for signs of infection, redness, swelling, and discomfort from the patient.
Apply new trach ties and dressing.
So I'm going to go ahead and slide new dressing under there for you. And then we're going to replace your trach tie.
Always leave the old trach ties in place until the new trach ties have secured the trach. Once the new trach ties are in place, you may remove the old trach ties. That's some really good Velcro. Complete respiratory assessment and document procedure.
Okay, so now that we're all finished, I'm just going to listen to your lungs one more time, check your pulse and pulse ox, and then I'm also going to document what the sputum looked like that we took out, and how well you were able to tolerate it, and what your pulse ox was throughout the procedure, and then I will go ahead and turn your oxygen back to where it was when I got here. And I'm also going to lower you back down, make sure your call light's in reach, and that you're comfortable before I leave.
Thank you.